This is the Doc Nation podcast. We are a movement founded by doctors, for doctors, dedicated to empowering medical professionals to reclaim control over healthcare decisions and advocating for their fair share of the industry's resources. Please note, the views expressed are those of Doc Nation and not necessarily those of our guests or referenced health centers.
Well, Aaron, hey, it's great to have you on the show. Excited to catch up with you. It's been a little while since we've talked on the Doc Nation side, and love to hear what's going on in your world with your business, your practice, and your perspective on healthcare. Maybe give us some background on, share with those that are listening in a little bit about you.
Hey, I'd just like to jump in real quick here and say thank you, Aaron. You've been a great supporter of Doc Nation. You were one of our first webinar guests a couple of years ago, and you've been with us through everything, and we're just grateful for you and your support for Doc Nation.
Yep, absolutely. And I'm happy to jump in with you and tell you thank you to you, because without you, we wouldn't be near as successful as we are today. And so the leadership that you guys have given, the advice, the contacts that you have given freely with no monetary financial incentive back to you from those contacts and third parties have all allowed us to succeed greatly beyond my wildest dreams. And so I'm very, very thankful and humbled to be on this podcast with you and to tell you thank you, because I'm happy to support you guys in any way I can. Absolutely.
Appreciate that, Aaron.
Yeah, absolutely. Well, what's going on right now? Well, I can tell you I was a previously owned hospital family practice doctor 6 years ago. And I've been out of residency now for 11. So for the first 6 years, 5 to 6 years of me being out of residency, I was owned by a hospital, large hospital system. And they gave me a 2.5 year notice that they did not think that a clinic system in my area of where I live would be profitable. And so they said, in 2.5 years, we're going to end your contract and we don't plan to have any more clinics in your area. So that gave me ammo to start thinking and planning about creating Mitchell Family Medicine. And we opened it up in June of 2019. And since then, we have grown over 500% in the past 5.5 years. So we're really excited about it. We keep adding to ourselves and taking on more providers. And since then, we've also been able to partner with some other people and open up a small branch of other clinics in our area in Eastern Arkansas. And so the Lord's provided great things from us, but I have to say that another plug here for Doc Nation is right when we're ramping up, Doc Nation came in, and Doc Nation was able to smoothly make this transition with us and help us through all the legalities and the possibilities and the contacts to make it even better. So they're good for that. But anyway, where we're at right now is we're getting ready to open up 2 additional locations, and we're going to open them up in the first quarter of 2025 and continue to expand our services. Right now, we're up to 15 providers hired, and we have space for 20. So we're slowly getting to this ramp up phase and realizing that primary care can be done, and it can be done correctly. It can be done with efficiency. It can be done with a good attitude. It can be done with monetary profit, which a lot of people don't see these days. A lot of hospitals, we see this cycle that come in, they come out over the past 20 years, and it can be done with a profit these days. And so, how do you do that? And how do you arrange your clinic system so that it has a great, if I can, Chick-fil-A feel for each and every patient that comes in? How do they feel loved and comforted? And how's our customer service equivalent to awesome patient care, and then a culture where our employees want to stay, our providers want to stay, and our patients want to come over and over again? So we're very blessed in this regard, and that's where we're at today. That's where we're at.
I just want to jump in and say they're doing great, and Doc Nation's a part of almost every facet of what they're doing there, just in support. And one thing that we were just in a marketing meeting with them. They got 96 new reviews over the last quarter. Unless I'm saying that wrong, Aaron, 96 new good reviews in the last quarter. So you know, primary care can be difficult. It can be difficult to get good reviews. And so I'm just proud of you guys and proud of the culture you're building, Aaron. What an experience it is to be a patient underneath your roof.
Yeah, we're excited about it. And hopefully we can continue to give great care. And I know we will. We have great processes in place, great providers. We hire the right people, and these people are helping us to get where we need to be.
So that's encouraging for those that maybe think that primary care is not an option, or it's maybe one of the more difficult areas of medicine to be able to do business. But there hasn't been easy, right? I mean, there's been some challenging parts of the process. So maybe talk to, what are you seeing in terms of what's happening in the healthcare landscape and how that's been challenging for you? And what are some of the things that you think on a grander scale, the reason why we exist is to not only empower individuals in their practice or their business, but also on a grander scale? Like, what do you think, what are some things that you have noticed about the industry as a whole that if there were some adjustments made, it would impact you, it'd impact your peers? Like, what, share with us a little bit about just the difficulty that you've experienced.
Certainly. So first off, primary care, we consider a lot in the medical community as kind of the lower end, if you will, of medicine. And but it's the one that has to have some of the most vast knowledge in terms of clinical skills. You got to know from wide range of ages, pediatric all the way through geriatric population, and then you have to turn around and provide that good care. But when you own a business, it changes things. It changes your perspective. And I have a lot of people that still come to me, and students that ask me all the time. They go, "Well, why would you want to do this all the time?" And number two is, how do you make a buck? Because it seems like reimbursements are decreasing every year. And it seems like I read an article almost every couple of weeks, maybe. And, it talks about Medicare reimbursements decreasing again. And we hear another podcast or article about how there's, 20% decreases over the last 10 years, 15 years, and how we haven't had an increase in Medicare budget in 20 plus years. And so we keep
4
going on.
years. Yeah.
How long has it been? 24? Wow.
Every year for 24 years, there's been nothing but reductions for doctors, but everybody else is seeing an adjustment. Why are doctors the only ones not getting a bump?
Absolutely. And it's time for us to fight a little bit harder on this. And I appreciate Docs Nation efforts in these things. And so where we're at today, though, is especially with Medicare, and I can tell you that right now our clinic sits at about 53% of all of our patients are Medicare and Medicare Advantage plans. So of these things, they make up a substantial part of our revenue every single year. And every time I hear that there's going to be a cut or we experience a cut, it is somewhat detrimental. And then we have to forecast, how much did we see last year? If we know that we're going to be cut 3 to 4%, is that tolerable? And what kind of services do I need to either pick up or scale back on to be able to meet budget for the next year? And so forecasting has become a real deal thing from year to year. Looking at all of these cuts, though, is extremely frustrating, but it also gives us an opportunity to think outside the box. If you are in medicine, especially in primary care these days, I do not see a future for you unless you can jump on the value-based care bandwagon. And that is the number one key to getting every single dollar back out of healthcare that you can for your office. And you have to be a part of it. In fact, I've talked to even people locally here in Memphis, great leaders in the medical community here, that say that Medicare is actually the way of the future for big dollars in healthcare. And so how do you reconcile the two? You have one source telling you it's the future, and you have another source telling you, hey, we're getting cut every single year. And so what do you do, and how do you reconcile that? And how do you play the game of value-based care to squeeze every dollar out of the healthcare system that it takes to take care of these patients? And that's where value-based care comes in. So although it seems frustrating,
Tell us what that is from your perspective. How would you define that? Because we have patients that are tuning in too. And Doc Nation, yes, we're focused on helping doctors thrive and be able to, but at the same time, like patient suffering here because doctors are not being respected and valued like they should be. So what does this type of medicine look like? How does it work?
Sure. Value-based care is was probably made close to 20-ish years ago and really started ramping up in the President Obama administration. And over time has evolved. And I believe even President Trump, when he was in office, tried to abolish parts of this value-based care system, but kind of failed within his first year of presidency. And it's because there's such a stronghold of the insurances on our government. And so they kind of overwhelm the government, and there's insider deals and all sorts of things, and we got to break down those barriers. Nevertheless, we're still left with having this value-based care. So first of all, just kind of what is it? Number one is getting rid of fee for service. So right now, you go to a doctor, you pay $100, you pay a fee for your service. In the future, that is going away. And I think in the next few years, we're going to see models that completely eliminate fee for service or bring it down to at least a level where it's unachievable to make it in medicine without doing a value-based care contract. So what they'll do is they'll take all of these people who are looking at a fee for service, and they'll say, well, we're going to take your group of people. We're just going to take your Medicare patients, for instance, and we're going to see if you can make them more healthy, because the data shows, and all this is data driven, that the data shows that a healthier Medicare patient is going to save money for the healthcare system. And so that is where value is supposed to be created. So the burden is shifted. The burden is shifting now to the provider to give value to the patient and the Medicare system. So there's many reasons why this has to happen. Number one is cost, the cost controls that are there. As we know, the cost of everything is up and up big time. Provider salaries are up, nurse salaries are up, hospital salaries are up, the cost of supplies are up, and it's going crazy. There is no seamlessly ending budget for Medicare or even these commercial plans that are out there. And so they have to try to control their costs, and this is one way to do it. So instead of focusing on the fee, they instead focus on long-term outcomes that provide value for the patient, therefore increasing their health. And by increasing the health, they decrease the need for these healthcare costs. So the number one is really just cost. Number two is quality, making sure that our patients are having quality care every single step of the way. Reducing admissions into the hospital is just one of those things. Reducing ER visits, getting them out of there. Chronic disease management. Can we keep their diabetes at a certain level? Can we keep their blood pressure at a certain level? And if we can incentivize a doctor to keep good quality of the patient, we know that the healthcare costs are going to be reduced because we have data that says so. So, if you can meet it, you do good, you get money. If you can't meet it, you're not going to get any money. So we're not going to create value. But there's a lot of problems with it. Value-based care is tough. There's a lot of problems. One of them is just technology. Many offices out there, they're not as good as maybe my office. We use a certain EMR system that's fantastic. It's super technological. It can do a lot of things for us, and it can give those codes out there that help us and assist us with our value-based care. But there may be a lot of offices that don't really have that capability. And so if you don't have the technology to keep up with it, you're already way behind, and you're never going to meet your value-based care models.
And I think that's a great point you're bringing up, and something we do in our office too is you have to invest. I think a lot of people try to save money. They see the Medicare cuts. They try to save money in their office by cutting overhead, cutting a lot of these more expensive EMRs that can do more for you. But I see it as the opposite, is you have to invest some money in your practice. And then in the end, that will pay dividends. It'll pay 2, 3x than if you're just trying to cut MAs and, see less, have less overhead and see more patients. You have to actually, in my mind, have the infrastructure in place with the good EMR, a good billing specialist, all those kind of things, and good people, so the patients have a good experience, and that investment pays off in dividends in the long run. But a lot of people see it the other way in medicine, and I don't know why.
Yeah, it's definitely frustrating for some of these, especially these smaller offices, to handle, onesie and twosie docs or nurse practitioners that are really just trying their hardest to serve their people. They're going to see that their income will decline year after year after year after year until they're squeezed out of the system or they're forced to apply. And so that's where they're at. But speaking of just associated costs, that is a barrier too. So the cost in general of these EMRs is just one thing, but in our office, how we do our costs is we actually hire the person to do the work for us and help us and assist us. And so we have someone on our dollar, our cost, that we have hired, and we pay them a handsome salary. They usually have a lot of clinical knowledge. They have excellent, computer skills and email skills, and they're able to, look at spreadsheets and make good analytical decisions about where each patient is for each payer at all times in the system. Because there's not just one system that handles these things. Medicare is just one. Then you have every Medicare Advantage plan. They're going to have their own system that you've got to work with. They're going to take every commercial patient, Blue Cross, Cigna, United, doesn't matter. All of them are going to give you a list of X amount of patients, and they say, here you go. You need to control these measures to get all your money. And if you don't, you're going to have downside risk and you're going to lose money for your patients. And so as we go through the system of value-based care, there is a great cost associated with it. To alleviate some of that, we hired it and we train them well. In fact, the office of this person is so important in my clinic that the office is right next to mine. And we are in there probably every day. Where are we at? Look, as of right now, we are the end of the second week of November. Most of these value-based care measures and things that we have to meet must be met by December 31st. So it's go time at our office. We are every day looking at the spreadsheets. We're every day. How can we get an inch closer? A lot of these things a lot of these metrics and care gaps and everything, they expect you to meet certain quality criteria. And if you don't meet it, you don't get incentive pays. You don't get bonuses. You don't get money, which then replaces the loss of lack of reimbursement. So we have this lack of reimbursement. We anticipate through just Medicare alone, not any other insurance, but just Medicare alone. For instance, our clinic is probably going to lose, based on the new contract next year, somewhere in the neighborhood of $250,000. Well, at the end of
Wait, I got to stop you there. How many businesses can just stomach a $250,000 loss with doing business? I mean, it's crazy just that we're so numb to that at this point. And that's every year. It's year over year.
And how many businesses don't have the ability to just adjust their pricing as they need to stay alive? Someone else gets to call the shots for them every single year. And it's a reduction every single year. There's no other industry that I've ever seen before that has to deal with that kind of a challenge.
Right.
Yeah. So
Sorry.
they're not going to get the 250. So they're 250 down, but they have more employees. They've been doing more. They've been doing better. No other business does more.
Payroll.
Yeah, more pay. Yeah. If any business outside of medicine, something significant would have to happen for them to lose that amount of money that they were expecting, or the year before, right? Some of their top salespeople left. Something had to have happened. Nope.
Yeah.
This is just the overlords saying, yeah, we're gonna change the goalpost, and you have to do this, this, and this, and make things up as they go to make sure their budgets are okay.
I mean, if the price of the Whopper went down 2% every year, Burger King would be bankrupt.
Exactly. And
the
Anthony, I
price
think
of
it's
lettuce and buns and burgers keep going up and up and up. But that's not, and it just, and Dr. Mitchell, you're making a great statement on how to fight against that. But the fact that we're so numb to it, and you guys do a great job at keeping your business running, if not even doing better in the system that it's in. I'm so over just laying down to these Medicare cuts. It's out of control. I don't know how any business would run. Any other business in the world that got a 2% cut every year would be bankrupt.
Right. So I think we're going to be seeing even more so if providers don't jump on the value-based care bandwagon pretty soon. We're going to see providers cutting the amount of Medicare patients, and that's the fastest growing insurer right now. So we will see cut after cut after cut of doctors, and next thing you know, the healthcare system is strained because we don't have providers willing to take care of these people. And so it's just a cycle that's not going to end. So the best thing to do in my mind would be that Congress get together and start making us a mandatory pay raise with at equals inflation at the very minimum.
That's right.
At least
That would be the best thing.
Well, think about the general
ways.
population. The general population over the last 4 years got their own income cut by a significant amount due to inflation. And look at the results. I'm not getting political, but look at the results. What happens when you stick where do we go? Anthony's bounced. When you stick your hand in everybody in the United States pocket, that was the number one issue. And it was an overwhelming vote to say, no, we can't afford groceries. We literally can't let this happen anymore. Where is that in medicine? How do we get together and say, no more of this?
It doesn't exist.
Well, to your point, Aaron, if the largest population is going to be on Medicare and needing Medicare services and they can't get it, think about the vision it takes to look out into the future. If we make these decisions today, where will that put us in 20, 30, 40, 50 years from now? We have this aging population that's going to be in this group of needing help with healthcare, and they're not going to get it. So is that going to be enough of a population to do what Reid's talking about, which is we've all felt our savings dwindle, our credit card balances go up, all this and that. Is this cohort going to be significant enough to say we can't keep doing what we're doing because we're trying to take care of our nation?
That's right.
And the nation's not be able to be taken care of because they can't even get into to see a doctor because doctors won't even see them anymore.
And so
They have to
Aaron,
pay cash to
Aaron
be
already
seen.
answered the question. He said two things. He said, number one, the government is beholden to the insurance companies. And then he said something about 15 minutes later. And he said, well, Congress has got to get together and we got to make decisions in Congress. Well, who's making those decisions for Congress? The big money insurance companies. So I hate to be doom and gloom, but that's where we're at right now.
Well, the good news is, to Aaron's experience in his own words, it's still possible to overcome in the midst of all this. The hope and the courage and the tenacity.
Yep.
I mean, not everyone's like you. I get that.
Medicare's taking a risk here, by the way, too. They're taking a risk that their data is going to work. Okay. And that all their data that they've gathered for years, they say we're going to save X amount of dollars if we do value-based care. Patient outcomes will be better and Medicare will save money. But is that really happening? Well, we're a little too early. A little too early to know if it really will. We think it is, but there's nothing out there right now that says, yes, we are saving year after year Medicare X amount of dollars. And so offices are getting held to this standard to provide this care, provide the quality care, to sign these contracts no matter what, or you're not going to make it. And so, yeah, we fit within that model, and it is frustrating from day to day, and we try not to let it overtake our need and our love to still take care of the patient. But it's still something we think about every day. So we'll see how it goes over the next few years, as if it's sustainable or not. But we think we found every dollar we fight for every single dollar. And sometimes I don't think it has to be that way. I wish it wasn't that way, but we do. We fight. We fight every day, and we're looking for every care gap, because you never know, you might miss the care gap by one denominator, and all of a sudden you're out incentive pay of thousands of dollars, and there's no turning back, because these insurance companies don't care. They want to see that you can perform, period. And that's where we're at. So we even talk more deeply about this, that it's now being attached to not only outcomes of the patient, and it's now being attached to the question of, is my doctor, is my provider even good? Yeah, and this is public knowledge, guys. A lot of these there's something called star ratings, if you're not familiar. But if you go to a insurance website, you can look up a doctor and you can see what their star rating is. All right. Their star rating is not whether or not they got a 5-star review on Google. Yeah. Now we love 5-star reviews, but if you go on a website, let's just choose United, you can look at provider and see what star level they are. If they're a 1 to 2 star, you know that they're not really pushing hard to meet all the incentives of the value-based care contracts. But if they're a 3 or 4 star, you know that they are doing everything they can in their office to meet these metrics. And so people can look at the star rating of a doctor and they can know suddenly, is that doctor good or not? And it's based all
Are they
off.
really good? Are they really good though? Are they really good, or are they just good in the insurance company's eyes?
Like good at what? Good
exactly
at what?
question.
See,
Exactly.
here's my
Compliance?
issue. We've been talking to Dr. Aaron Mitchell for 30 minutes, and 26 minutes of it has been about business, like the business operations. And I get it, you spend a lot of time doing that, but you say you have to fight for every single dollar. You're spending more time fighting for dollars, hitting metrics. Like who decides if you get a 2 or 3 star, 4-star rating?
Absolutely, the insurance company. It's not up to a patient. So I may have 5 stars all day on Google, which is wonderful. I love it. I'm a really nice doctor. He's caring. That's wonderful. You go to the insurance website and say I missed a couple of care gaps in there, and somebody didn't ever go for the colonoscopy or mammogram because they forgot. I'm on the hook for that, and it shows that I've got a 1.8 out of 5, and all of a sudden, I am a nobody. That insurance points their finger at you and says, you're not any good. Why would we give you our premium money? People are paying our premiums. Why would we pay you the reimbursements we're going to pay you when you're a 1.8 star versus a 5-star that we could get somewhere else? And so the insurance companies are now starting to direct who is good and who is bad in medicine. And it's been going on definitely in the last 3 years. And so we follow that pretty closely. We work really hard to improve our star ratings, both in the insurance eyes and in the patient eyes. And patients are none the wiser. They have no idea how hard it is in medicine to really look good in insurance eyes and get the reimbursements that we all work hard to receive. It's extremely taxing on every practice to go after every single dollar.
I'm seeing a video, what would that be like? I picture Star Wars and the overlords and the insurance companies and the star ratings, like exposing just the dynamic of how they're trying to manipulate and control everything. And
I'll take you even further. Star ratings are now going to be attached, and they are attached, and you're starting to see this, to physician employment contracts. You see it all the time. Not only do physicians get paid by salary and by work-related value units, WRVUs, which you're very familiar with, but now we're starting to see performance-based and quality-based contracts for providers. If you hit these metrics individually, to provide the colonoscopies, the mammograms, the blood pressure, the diabetes, and everything, then you're a good provider and we're going to pay you more. And if you don't hit these metrics, which you are responsible for, you're the provider, which you're responsible for, then by golly, I'm sorry, Mr. Provider, you're just not very good and we're not going to pay you what we think you deserve. And so the performance of the provider is being directly attached to their pay. And that's not what they signed up for in med school.
No.
So it's tough for everybody. It's tough. So you got to work on it. You got to be super diligent about it. You got to coach your people. Very taxing on the administrative overhead and burden to provide quality care, but to train your providers, to also train the patient how to be a good patient. This is hard. It's hard. So, you got to go tell the patient, look, I love you, sir, ma'am. These are the certain things that we need you to do, and your insurance requires you to do. And if you don't do them, I'm going to look bad. Yeah. And so don't look bad. So it's frustrating.
All right, thanks.
But we're happy to at least go down the journey with all of them and let them know we still love them, give them compassionate care. In the meanwhile, in the background, we're cutthroat. We're going after every dollar we can. We put on a great, it's not really a front. It's real. We love our patients, but behind the scenes, we're killing it in terms of let's get these metrics met.
We have a lot of residents and fellows listen to this. And so, Aaron, we're just grateful that you are here. And there's a number of people who have asked me some business questions, and so we answer them. But I think it'd be kind of fun to shoot them your way. So, Aaron, if you're okay with us once in a while letting someone pick your brain, it might be different coming from a physician. So thanks so much, man. You have so much knowledge, and we appreciate you sharing it with us.
Happy to do it. God bless you. Thank you.
Thanks, Aaron.
Thanks,
All right,
Aaron.
talk later. This has been the Doc Nation podcast. If you like what you heard, be sure to subscribe, rate, and leave us a review on Apple Podcasts, Spotify, or wherever you are listening to us. Your feedback really helps us reach more listeners like you. We'd also love to hear your thoughts and any topics you'd like us to cover in future episodes. Don't forget to follow us on Facebook, Instagram, and LinkedIn for updates, behind-the-scenes content, and to join the conversation. Thanks for listening.